Okay. So, good morning, everyone, and thank you so much for coming along to the public health webinar. Um, my name is Dr. Hayley Connell, and I am the programme lead for the online Masters for Public Health. And we've also got the lovely Margaret Ashton with us today, who is the administration for Public Health. So what we're going to do today is go through this little presentation that will hopefully give you some information that you might want to know about the programme, and then what we can do is answer any questions. So I'll just jump straight into the presentation. Okay, so what I thought I would start off with is, hold on one little second till I just move this screen out of my way. There we go. Okay, so starting off is just a little bit of information about public health. I'm sure you're all quite aware since you are interested in the programme, but I thought it would be nice to give a little bit of a definition about how we see public health at the University of Glasgow. So the definition is the science and art of protecting and improving the health of people and their communities. And that encompasses a huge amount of different sort of courses, lots to do with health inequalities, and we look at lots of different things with people from lots of different backgrounds. A Master's in Public Health at the University of Glasgow will allow you to develop the knowledge and skills that you need to make a difference within public health if that is what you're interested in. The really cool thing about the online learning programme is that it will allow you to become a student at the University of Glasgow and experience the outstanding education that we can offer without the need to relocate. So you can literally come from anywhere in the world and become part of our student body. So, there are several different programme options, and some people might be only interested in the Masters, but I thought it was important to just showcase that we do also have the postgraduate diploma and the postgraduate certificate as well that might be of interest to you. And I'll go through all three of them just so you can see what the difference is. So, first off is our Masters of Public Health Online. So the structure of this is basically made up of 180 credits. So that's made up of three core courses that you absolutely must take, and I will go over the what the core courses are just in a second. And they're all 20 credits each, and then you get to pick three optional courses, and this just gives you the opportunity to take part in courses that might be a little bit more to do with things that you're interested in. And then finally, you will take part in a supervised 60 credit self-directed research project, and each student is assigned a supervisor in order to help them along that journey. And that totals your 180 credits for your full masters. So the Masters online is conducted on a part-time basis, and the average student will finish this within 3 years. We have had one or two students finish in 2.5 years, but that would be the absolute minimum that we would allow because it is quite an intensive course, and to do it any quicker than that would be really quite tricky. We also allow a level of flexibility. A lot of our students are working full time and have lots of other commitments, so you do have up to 6 years to complete your degree. So let's have a look at the postgraduate diploma in public health. So basically what the difference is that you just don't do the final project. So you still do the same three core courses, you still get to pick your three optional courses, and that will total your 120 credits. And you would finish that in 2 years, your 24 months, and then you wouldn't progress on to doing your project, and that would give you your diploma. The postgraduate certificate is a little bit different. So for this, you would do two core courses. You have to do the Introduction to Epidemiology and Statistics, which is one of our core courses, and then you would be expected to do Principles of Public Health as well, which is one of our other core courses. And then you would get to choose one additional optional 20 credit course, something that you're a little bit more interested in, and that would total you at 60 credits. And it takes 12 months part-time to complete the certificate. So three different options for you to choose from. You can also start off with a certificate and decide to go on to the masters, etc. There is a bit of flexibility around this. Okay, so our core courses, they are all 20 credits each, as I have mentioned, and they are Introduction to Epidemiology and Statistics, Principles of Public Health, and we have a Research Methods in Health and Wellbeing course as well. If you go onto the website, you can click onto these core courses and it gives you lots of detail about what is taught on each of these courses. So basically, Introduction to Epidemiology Statistics, you will get sort of 5 weeks of epidemiology and then 5 weeks of statistics. Principles of Public Health is basically a flavour of 10 weeks of all different types of public health focus, and it's a really nice course. And then Research Methods, make sure that you are set up to do your project when you're ready. We have an array of optional courses for you to choose from. So some of this is advanced epidemiology, if that's where your interest lies. We also have things like globalization and health economics. If you're more interested in health promotion, we've got a dedicated course for that. We also have access to more mental health orientated courses. So we've got your cultural, social, and biological determinants of mental health, etc. If you are very interested specifically in qualitative research and that's something you want to do a little bit more of, we've got a designated course for that as well. And we've got our brand new, very popular course, Geographies of Health and Health Inequalities. So for all of our online courses, we ensure that the teaching is of very, very high quality. We go in very often to make sure that everything is up to date. We've done very recent overhauls of all of our core courses and quite a lot of our optional courses as well. So you should find all of the teaching on there very, very engaging. So just to give you a very typical sort of structure of what each year might consist if you were to do the masters. So you can enter the masters at three different points. So you've got a September entry, a January entry, and an April entry. But this sort of typical course here is for a September entry. So in year one, you would start off in semester one with our principles of public health, and that would give you a huge sort of flavour of all the different aspects in public health. And it would help you as well to understand maybe where you're more interested in different things. Starting in semester two, so January, you would do our introduction to epidemiology and statistics, and already by the time you're getting to April, you have completed two of your core courses already. You will be then invited to choose a optional course within semester three, so that could be health promotion or geographies of health. And then you're already into year two. So you would start that off with your final core course, which is research methods. And then you would get to choose one of our semester two optional courses. And there's quite a few options for you in there. And then the final semester in year two, you would pick your final option, and that would be the taught component of your master's complete. And then in year three, you would have a full year to designate to your research project. And this is a bit of a perk for the online course. The on-campus students realistically only get between April and August to do their research project because everything is much more condensed, whereas the online students get a full year in order to really focus themselves on their research project and will have a supervisor to support them through that. So, you might be thinking, why our program? So, I think one of the key things is you get to be part of the University of Glasgow community, which I think is a really nice thing. But looking more specifically at why you might want to choose us, so we have world leading academics and practitioners from all over the world that teach within the University of Glasgow, and we've got a huge amount of expertise in lots and lots of different areas, particularly in epidemiology, statistics, and we've got a lot of sort of public health researchers. Huge amount of research goes on within the department. The program itself is multidisciplinary, so all of the staff have lots of different backgrounds and focus, and that means that you're being taught by people with lots of different expertise, which is excellent for both the teaching and for your supervision experience as well. The university itself is classed as world leading and is internationally excellent in the research excellent framework. So the research that is done within the department and the university wide is looked at as a sort of excellent level within that framework. We pride ourselves in the fact that we do constant improvements and updates to the courses. So there's a huge amount of new developments happening all the time. The courses are looked at on a yearly basis. The excellent part is that the teaching itself is research focused, so you get a lot of case studies and sort of real world examples of all the teaching. Um, we're always looking at new courses and updating the course catalogue. We're also very good at sharing courses as well, so there is opportunities to jump onto to other courses within the school itself. We use interactive online teaching platforms to ensure that your sort of learning experience is active. So we want you to engage with your learning. We also give you lots of opportunities, although it is asynchronous, which means that it's self-directed learning. We give you a huge amount of opportunities to engage with both ourselves as staff and with students. So we do discussion boards, we give you opportunities to take part in Q&As, and some of the lectures are live as well. So it's not all asynchronous, although that is the majority of the teaching. It might be of interest to you, but the University of Glasgow is classed as a Russell Group University, which means it's part of 24 world-class research intensive universities. And finally, all of our teaching is focused on graduate attributes. So we don't teach you just for the sake of teaching you. We look to see what sort of attributes you will need when you go out into a public health career-driven world and what sort of skills you will need. So career opportunities. So this list is not sort of specific to these particular career opportunities. If you do a master's degree, you have a demonstration of transferable skills. So you're able to learn, to time manage, to project manage, and these are transferable to a huge array of careers. But this is some of the careers that our previous students have went on to. So of course there's public health researchers, health promotions. If you're interested in epidemiology, you can focus your optional courses on that and become an epidemiologist, health information manager. We've also got people that are interested in policy, are perhaps more patient facing and want to do community health work. And lots of different things around that. You can, of course, become a health educator, and there's opportunity for further study. There isn't a direct link from the master's into a PhD program. However, networking opportunities may help you sort of carve out that path. And what it also might help is for you to decide what it is that you're interested in and perhaps start to create a research question that might be good for a PhD. And we can help to support in terms of finding potential avenues into that. So importantly, what are the entry requirements into our program? So you need to have a 2-1 in a relevant degree. And a relevant degree is basically anything that is science or health based. You can also have a 2-2 in a relevant degree with some evidence of professional work experience. And that needs to be within sort of public health or healthcare, something that is related to the master's program in some way. We will, in very rare circumstances, look at a third class degree, but this is in individuals who perhaps have studied quite a while back, have maybe gotten a third class degree, but have had a huge amount of work experience, really relevant work experience since then, and we would look at that on a more individual base. Applicants who have non-relevant degrees will be required to have public health experience at a professional level. If you are interested in the course, the program, sorry, but you are not sure about your suitability, there's an email address that you can email over your what degree you have, what experience you have, and we can have a wee look at it and give you an idea of whether or not you might be suitable or not before going through full application. So if you want to look for any further information, this is the website that you can have a wee look at. It has further information on how to apply, what the fees are and how you can pay the fees, the application process. We accept applications right up until the start date, so there isn't a sort of specific deadline as such. and it's got lots of contact information there for various different people that you might want to contact. It also has a list of our core courses and courses that are available to you if you want to know a little bit more information about each of those and what is taught on it. And that is everything from me today. So thank you so much for your time, and I welcome you to ask any questions, and we're happy to answer. So there is a question here. What would be the ideal number of hours that would need to be invested on a weekly basis? And would it be feasible for me to take this program on while working full time? So, basically the way it works in terms of hours, is 10 credits are worth 100 hours of study. So if you think about a 20 credit course over a 10-11 week period, that equates to about 200 hours worth of study. And that is doing the actual teaching material, but that's also reading out with the top material as well. So reading evidence, papers, looking up lots of different things that we might encourage you to do. So that's very roughly what we would equate 20 credits to, would be about 200 hours. It's absolutely feasible to do this program while working full time. Pretty much all of our students currently have full-time jobs. They work quite high professional jobs. We've got a lot of people within healthcare, within the NHS. We've got people who have busy family lives, and they're all able to do that. The really good part is the fact that you do have a 6-year window. So we are very supportive and are happy to work with you if you're finding anything a little bit difficult, but it's absolutely doable. What does a week of study look like? So webinars, workshops, readings, essays, projects, and how often do I get to interact with my program lead? So it is an asynchronous program, which means it's self-directed. And the good part about that is that you are able to go on and do your course at any point. So you can go on in the morning, at night, whenever it is, the content's all there for you. There will be sometimes some pre-recorded, so sorry, live lectures, but they are pre-recorded for you. So if you're able to make the live lecture, that's fantastic. But if you're not and you're busy doing your full-time job, that's not a problem at all. We always make sure that they are recorded and uploaded for you so that you don't miss out on anything. If there is any sort of extra things that are put on, Q&As, etc., these are all recorded as well. In terms of interaction, you can interact with your students and program lead and with Margaret, the admin, anytime you want. You have all of our contact details, and we are more than happy to engage with you and help you with anything at all. So opportunities to network with other students and professionals, like conferences or in-person events. So a lot of our online students obviously come from all over the world, so we do try to make sure that there are opportunities to attend sort of online events. So we will we've got like an online hub, and messages are put on there quite often, mainly from Margaret, and she will put up lots of different events that are available that are online. If there's any sort of student skills workshops that are online, she will share them. And we do have quite a busy university, so there is quite a lot of things that you can take part in. If you want to take part in in-person events and you're sort of in the area, you're absolutely welcome to come onto campus at any point. Just because you're an online student doesn't mean that you can't come onto campus. You're more than welcome. Okay. There's another one. Is there any preparation I should do before the course starts in September, such as recommended book reading lists? No, there isn't anything that we would expect you to know prior to starting. And the great thing is, if you were starting in September, you would be starting with our Principles of Public Health, which is an excellent course because it really gives you an introductory flavour of absolutely everything you need to know within public health. So it's a 10-week course, and each of the 10 weeks focuses on something very slightly different. And within that, there will be lots of sort of recommended and essential reading that you can start to go through in your own time. Will I be issued a physical student card and will have access to the libraries and resource centre? So you have access to absolutely everything that an on-campus student would have. In terms of physical student card, Margaret, do they get a physical card?
They do. So when you've completed your registration, fully completed it, uploaded a photograph, that's the important thing. You will be sent a student ID card. And you will have the same access if you were in Glasgow or you're a local student, you have the same access to all the university's facilities as a non-campus student would have. There are some reciprocal agreements with universities and with libraries and other universities where online students can access their libraries just by simply having a student ID card. But yes, you have the same access to all university facilities as an on-campus student has, but you must upload a photograph. That's quite a number of students, online students, contact and say they never get an ID card, and when I go in and check, it's because they didn't upload a photograph. So that is essential for you to get a student ID card.
Thanks, Margaret. Okay. Any more questions at all from anyone?
Can I just add here that students that have accepted an offer and they call it progress to registration, I will contact them in advance of actual registration with full details about the programme. There will be a timetable, a programme information document, and it will just give you a better idea about how your studies will pan out, other facilities in the university. So you will get that in advance of registration open. And registration normally opens sort of mid-August. That's not, the final date has not been confirmed yet, but it is usually sort of mid-August from when you can start to register.
Okay.
So somebody's asking there, is there an option to switch to the on-campus degree? They are I have to say, they are two completely different degrees. It's not, the fees are different. So it's not quite straight, it's not a straightforward thing. It's not something we've ever happened. We would have to look at it, but it's not as simple as somebody starting a PG set online and then moving to an MPH or um, a PG dip. We would have to look to that on an individual basis, but we have to be honest, it's not completely straightforward because it is two completely separate degrees. Although it's similar, um, it's a similar curriculum and you're getting the same courses and the same kind of um, learning material, they are still two separate degrees.
Yeah, the teaching on both is almost identical. And the staff members are all exactly the same staff members. But as Margaret said, it might be a little bit trickier than just switching over, but we certainly could look at it. Um, so there's another one here. Could there be an opportunity to complete a research project as part of the dissertation module, which involves other departments within the university? Yes, there absolutely is opportunities to do that. So within the university, we are very open to working across the university, and there's lots of networking that happens. You will get a public health supervisor, but you don't always necessarily just have one supervisor. Some students have two or three, depending on the project itself. We are moving towards a more sort of supervisor-led dissertation strategy, and that is just because it helps take the pressure off students a little bit of trying to come up with a research project. So what we're going to do is start to offer project titles out to students that you can choose from. But if a student has a really good idea, so some people come from really high up backgrounds and they've got really niche areas that they're interested in. If that is the case, we're absolutely in support of you coming up with ideas and we can find supervisors to support that as well. Okay, any more questions? No? Okay, So thank you so much for coming along. Hopefully you found this informative. If there is any other questions that pop up that you think I wish I had asked that at the time, please do not hesitate to contact either myself or Margaret. And we would be more than happy to help you with any questions that you have, whether it's you're struggling to get forward with the admissions process or you just want to ask a really simple question, then please do not be afraid to come forward to us. But thank you so much for your time, everyone.
Thank you.
Thanks.